Hello. A variety of inhaler devices are available to treat lung conditions. This video will show you how to use your Easi Breathe inhaler. If you use your inhaler correctly, you'll get more of the medication into your lungs, giving you better control of your breathing problem. But if used incorrectly, you'll have poor control of your condition, with the risk of side effects, such as a sore throat or mouth infection. Before you use your inhaler for the first time, or if you've not used it for 5 days or more, you need to test spray it. To test spray your inhaler, unscrew the top of it so you can see the metal can inside. Open the cap. Shake the inhaler and spray the aerosol into the air by pressing the can with your finger or thumb. Close the cap and put the top back on. Your inhaler is now ready for use. You should always sit upright or stand up when using your Easi Breathe inhaler. Shake the inhaler before use. Hold the inhaler upright and with your other hand fold down the cap that covers the mouthpiece. When you're ready, breathe out gently as far as you comfortably can, but not into the mouthpiece. Now place the mouthpiece into your mouth and between your teeth, but don't bite down on it. Close your lips around the mouthpiece to form a tight seal. Make sure the inhaler is upright and that your fingers are not covering the air vent at the top. Now breathe in through your mouth, slowly and deeply. You'll feel a puff of medication, but don't stop breathing. Keep breathing in as far as you can. Remove the inhaler from your mouth while holding your breath for up to 10 seconds, or for as long as is comfortable. Now breathe out slowly and immediately close the cap over the mouthpiece. If your doctor has told you to take 2 puffs of your inhaler, wait for 1 minute before repeating the whole sequence. If your inhaler contains a steroid, brush your teeth or rinse your mouth with water and spit it out after every use to prevent mouth infections. Ask your pharmacist if you're unsure whether your inhaler contains a steroid. Ask your local pharmacist for advice on how regularly you need to reorder your inhaler. If you're unsure about how to use your Easi Breathe inhaler or have any other questions, speak to your GP, practice nurse or pharmacist for assistance.